Welcome to the Ageless Woman Podcast, where modern science meets timeless self-care for limitless vitality. I'm Dr. Cindy Groh, a board-certified nurse practitioner and the founder of My Venus Club. This is a space for women who are ready to understand what's actually happening in their bodies and finally get real answers. If you've been told your labs are normal, that this is just a part of aging, or that you just need to try harder, and if you've sat through those 15-minute appointments left with just another prescription to manage symptoms, or maybe feel like you've lost a part of yourself, you're in the right place. Before we begin, just a quick note. This podcast is for educational and informational purposes only and is not intended to replace personalized medical advice, diagnosis, or treatment. Always consult with your healthcare provider regarding your individual health needs. Here we go deeper. We connect the dots between your hormones, your metabolism, your genetics, and your lifestyle so you can stop guessing and start feeling like yourself again. So let's get started. Today's topic is one of the heaviest and most important we'll ever discuss on this show: brain aging, dementia risk, and Alzheimer's disease. And I want to start by telling you something I don't say publicly often. I carry the ApoE34 gene variant, one of the strongest known genetic risk factors for Alzheimer's disease, and my family has a history of Alzheimer's disease. So today, I'm not talking to you as a nurse practitioner. I'm talking to you as a woman who's looked at her own genetic report and had to decide, what do I do with this information? This episode is for you if you've ever wondered about your own risk, if you've ever watched a parent or grandparent decline and felt that quiet fear in the back of your mind, or if you just want to understand, really understand what actually protects the brain as we age. I'm going to walk you through the real numbers, what the newest research says about prevention, why your genetics are not a life sentence, and why I believe hormone health is one of the most under-discussed pieces to this entire puzzle. Let's start with where things actually stand right now, because I think most people are working off numbers that are years out of date. As of the newest 2026 data from the Alzheimer's Association, an estimated 7.4 million Americans aged 65 and older are living with Alzheimer's dementia. And if we don't see medical breakthroughs, that number could climb to nearly 14 million by 2060. And here's a stat that really stopped me in my tracks. Between the year 2000 and 2024, deaths from stroke, heart disease, and HIV all went down, but Alzheimer deaths went up by 134%. 1 in 3 older adults today dies with Alzheimer's or another form of dementia. That's more than breast cancer and prostate cancer combined. And almost two-thirds of Americans living with Alzheimer's are women. I'm going to come back to that in just a little bit because I think that's one of the most underexplained facts in all of women's health. Here's the gap that really gets me though. In recent national surveys, 99% of Americans said brain health matters just as much as physical health. 99%. But only 9% said they actually know how to protect their brain. That's a 90-point gap. That's the whole reason I wanted to record this episode. I really want you to understand what the risks are and why it's so important to really start thinking about your brain health and starting to protect it. Now, I want to slow down here because I think we often talk about dementia in clinical terms, prevalence, cost, statistics, and we skip over what it actually does to real families. New research published this year modeled that full economic weight of dementia in the U.S., and it lands at about $818 billion for 2026 alone. And here's what really struck me the most. Most of that isn't even in hospital bills. It's 6.8 billion hours of unpaid care every year provided by 5.2 million family members and friends, and a lot of them still in their prime working years. That labor alone is valued at $237 billion. On top of that, families are absorbing about 20% of the medical and long-term care costs directly out of pocket. And 41% of dementia caregivers are living in households earning less than $50,000 a year. So this disease doesn't just take someone's memory, it can take a spouse's retirement, an adult child's career trajectory, years of a caregiver's own physical and mental health. I've experienced loss in my own life that reshaped how I see all of this. And I think it's important to say out loud, navigating this, the healthcare system, the cost, the caregiving, is genuinely hard on top of already being heartbreaking. If you're in the middle of that right now, I see you. And none of what I'm about to say is meant to minimize how hard this is at all. But this is exactly why I believe so strongly in getting ahead of this years before symptoms show up. And the thought of me becoming a burden on my own family or creating a hardship for my family is what really drives me to be proactive in my own health and wellness and to be so passionate about helping others optimize their health span and minimize the risk for this horrible disease. Okay, let's talk genetics now because this is where I want to challenge something a lot of people believe. The 2024 Lancet Commission, this is the most rigorous review of dementia prevention evidence that exists, concluded that up to 45% of dementia cases worldwide are linked to 14 modifiable risk factors: blood pressure, cholesterol, hearing loss, vision loss, physical inactivity, smoking, diabetes, depression, social isolation, traumatic brain injury, alcohol, air pollution, education, and cognitive engagement, all modifiable. Now let's talk about ApoE4 specifically. Since I carry it myself, about 15% of people carry one copy and 2 to 3% carry two copies. It is genuinely one of the strongest known genetic risk factors for Alzheimer's. I'm not going to sugarcoat that for you, but here's the finding that changed how I think about my own risk. Research out of the FINGER trial in Finland, a real randomized control trial, found that ApoE4 carriers who made changes across nutrition, exercise, cognitive training, and vascular risk management actually improved their cognitive function and memory over 2 years compared to ApoE4 carriers who didn't make those changes. And some of the follow-up research suggests that combined lifestyle strategies may reduce ApoE4 associated risk by as much as 40 to 50%. That's right, 40 to 50%. Let that sink in. The people with the highest genetic risk may have the most to gain from taking this seriously. This is the whole philosophy of why I built my Venus Club. You can't optimize what you don't understand. Genetic testing, epigenetic testing, and advanced hormone testing, none of that exists to scare you. It exists to let you know exactly where to put your energy instead of guessing. Now let's get back to that stat of 2/3 of Alzheimer patients are women. This is where I get, honestly, a little fired up because for a long time this was chalked up to women just live longer. That is not the whole story. Estrogen receptors are all over the brain. Estradiol supports synaptic plasticity, mitochondrial function, and the blood-brain barrier. And when estrogen drops sharply at menopause, the brain loses a genuinely protective input. A study out of Stanford Medicine this year looking at autopsied brain tissue found that women on estrogen hormone replacement therapy had a 35% reduction in the odds of developing Alzheimer pathology markers. Other research has found that women who went through early menopause, meaning less lifetime estrogen exposure, showed faster cognitive decline and more brain changes associated with Alzheimer's, and that hormone therapy seemed to soften that effect. But, and this is the part that gets left out of the headlines, timing and formulation changes everything. The older studies that made hormone therapy look dangerous for the brain were largely done in women starting therapy in their late 60s or beyond, often with a specific oral formulation. Newer research increasingly points to a window of opportunity around the menopause transition itself, where the type of hormone and how it's delivered, oral versus transdermal, for example, actually changes the outcome. This is exactly why I don't believe in one-size-fits-all hormone protocols. It's why advanced hormone testing is central to how I work with every woman in my practice. You cannot make a good decision about hormone therapy and brain health from a single generic blood panel. Let's make this practical. If you remember nothing else from this episode, remember these 5 things. Number 1, movement. Exercise touches more aging pathways in the body than anything else we know of. So aim for about 150 minutes a week of moderate activity plus 3 strength training sessions. That's critical. Number 2, a Mediterranean style eating pattern has been associated with 35% reduction in dementia risk, and in some studies of ApoE4 carriers specifically. Fatty fish, 30 different plant foods a week if you can manage it, and minimize adding sugar. That accelerates inflammation and insulin dysfunction. Number 3, sleep. Sleep is absolutely foundational and critical. Your brain does active repair work while you're sleeping. It's called the glymphatic system, and it clears out metabolic waste, including amyloid beta, the protein associated with Alzheimer plaque. 7 to 9 hours consistently. You gotta have it. Number 4, metabolic and heart health. High LDL cholesterol and uncontrolled blood pressure are now formally recognized as dementia risk factors. What's good for your heart is good for your brain. And number 5, hormone optimization done properly with real testing, not guesswork. Prescribed to the right woman with the right formulation, the right dose, and giving it to her with the right route of administration. That's so critically important. Now, if you carry a genetic risk or you've watched someone you love decline, I understand wanting to look away from this topic. I've felt that pull myself, but avoidance doesn't lower your risk, vigilance does. Knowing your ApoE status, getting real epigenetic and hormone testing instead of assuming your labs are fine, building your life around the habits we just talked about. This isn't about fear. It's about giving yourself and the people that you love the best possible odds. You can't optimize what you don't understand. That's true for hormones, it's true for your metabolism, and it's absolutely true for your brain. So let's say you're sitting here thinking, okay, Cindy, I hear you, this matters. Where do I actually begin? I don't want you leaving this episode feeling heavy without not knowing what to do. So let me break it down a little bit more. Step 1, know your numbers before you guess at your risk. Understand what your blood pressure is, your LDL cholesterol, your fasting insulin, your glucose, your vision, your hearing. These sound almost too simple to matter for something as serious as Alzheimer's, but remember, they're on that list of 14 modifiable risk factors for a reason. This is the low-hanging fruit, so to speak, and most people haven't ever checked it. It's so important. Number 2, if you have a family history like I do, consider genetic and epigenetic testing, not to scare yourself, to personalize your plan. Someone with an ApoE4 variant and someone with no known genetic risk should probably not be doing the exact same protocol. I test differently, I monitor differently, and honestly, I push myself harder on consistency because I know what I'm working with. I know what my risks are. Step 3, get real hormone testing. If you're in perimenopause, menopause, or beyond, not a single generic panel pulled at a random point in your cycle. Look at the full picture. Estradiol, progesterone, testosterone, dihydrotestosterone, estriol, Estrone, so important. They all matter. And how your body is actually metabolizing and detoxing those hormones, well, that is critical. This is where so many women get dismissed with labs that are normal, so to speak, when the body's actually needing deeper insights and the body actually needs and is asking for more. Number 4, pick one lifestyle lever and start there. Not all 5 at once. If you haven't ever done strength training, start there. Brain protective habits compound over years, not in days. So consistency beats intensity every time. And step 5, the one people often skip, build your support systems before you need it. If you have a family history of dementia, have that hard conversation now about care preferences, about finances, about who does what, while everyone involved still has full capacity to plan together. I've watched families try to make these decisions in crisis mode, and it's so much harder than doing it early with a clear head out of love instead of panic. None of this has to happen overnight, but it does have to start sooner rather than later. I leave you with this. When I first saw my own genetic results, I had a choice to make. I could treat with information as if it was a countdown clock, or I could treat it as a map. And I chose to treat it as a map. And every single thing I've shared with you today, the research, the testing, the lifestyle levers, that's what's on my own map too. I'm not standing outside this issue looking in. I'm living it right alongside you, one informed decision at a time. If someone you love is navigating memory loss right now, or if you've been quietly worried about your own risk and didn't know where to start, I hope today gave you something really to hold on to. Not fear, but a plan. So until next time, keep building your foundations, keep being curious, and keep asking those hard questions to get you the answers you deserve to help you optimize your health. Thank you for being here with me today. If this episode resonated with you, I invite you to share it with someone who may need to hear it also. And if you're ready to start understanding your body on a deeper level and getting the clarity you deserve, you can learn more about my Venus Club at myvenusclub.com. We offer a limited number of memberships for women who are ready to take a more personalized, in-depth approach to their health. So apply for a membership. There's no pressure, just an opportunity to start a different kind of conversation, one that focuses on you, your body, and what you truly need. Because once you understand your body, everything changes. I'll see you in the next episode.